Hello everyone, I'm Anas Al-Ubaidi and welcome to this lecture or session. And the title or the topic of this lecture or session is Setting Standards for Administrative Excellence Using Key Metrics, and it is part of the chapter that is about the foundations of excellence in healthcare administration. And of course, this session or lecture is part of the Certified Medical Administrative Assistant course program by ACMSO. Introduction. Administrative excellence in healthcare goes beyond ensuring daily tasks are completed. It involves creating a high performance environment where patient care, organizational efficiency, and employee satisfaction thrive. At its core, administrative excellence is about setting measurable standards that guide operations, ensuring consistency and quality. Key points. We'll start with understanding key metrics. A key metric is a measurable value that indicates how effectively a team or individual is meeting goals. For administrative healthcare professionals, these metrics often fall into three key categories. Patient satisfaction metrics, metrics like patient wait times, appointment ease, and communication quality measure how well the patient's experience is managed. Accuracy metrics, this includes error rates in patient records, claims processing, and billing accuracy. Efficiency metrics, how quickly and effectively tasks are completed, including appointments, scheduling, claims processing, and inventory management, i.e., if patient satisfaction scores are low in surveys, metrics such as average wait time and follow-up response rates can pinpoint causes for concern. And here's a diagram on key metrics in healthcare administration. Another key point here, the importance of benchmarking. Benchmarking involves comparing current performance metrics against internal standards. Industry benchmarks or competitor data, it creates a reference point for assessing improvement opportunities. Steps in benchmarking: identify key performance indicators, KPIs, as for short KPIs or KPIs, which is short for key performance indicators, relevant to your clinic or organization. Compare with industry benchmarks or prior performance data. Set attainable but ambitious goals based on findings, i.e., if a clinic's average patient wait time is 30 minutes, but the industry standard is 20 minutes, the organization can analyze bottlenecks and implement scheduling improvements. And here's a diagram on benchmarking process in healthcare. Another key point here, measuring progress against goals. Key metrics are meaningless without effective monitoring. Progress is tracked through performance dashboards and regular audits. You should use real-time tracking tools like practice management software, conduct monthly or quarterly reviews, solicit feedback from employees, patients, or stakeholders, i.e., a dashboard reveals that billing claim errors decreased from 7% to 4% after updating software, proving the efficacy of the implemented changes. And here is a diagram showing like a draw, showing degrees in billing claim errors over time. Another key point, setting smart goals. To achieve excellence, goals must be SMART, S-M-A-R-T, S for specific, M for measurable, A for achievable, R for relevant, and T for time bound. So S for specific, M for measurable, A for achievable, R for relevant, and T for time bound. Each goal should reflect the organization's priorities and align with patient care objectives. I.e., a SMART goal could be reducing appointment scheduling errors from 15% to 5% within 6 months, leveraging staff training and scheduling software. And here is a diagram on SMART goals as S for specific, M for measurable, A for achievable, R for relevant, and time bound for T. Another key point here, continuous improvement. Administrative excellence is not a one-time achievement, but an ongoing process. Continuous improvement involves regular re-evaluation of metrics, staying updated on industry trends, investing in staff training and infrastructure. i.e., a clinic implements automated appointment reminders to reduce no-show rates, re-evaluates after 3 months, and refines the system to improve effectiveness. Another key point here, common pitfalls to avoid: setting unrealistic or vague goals, tracking too many metrics leading to data overload, ignoring qualitative feedback like patient comments, i.e., tracking only quantitative benchmarks, for example, response time, but ignoring qualitative factors. For example, tone of communication may lead to a skewed understanding of patient satisfaction, as we need to balance both the qualitative factors and the quantitative factors, not to focus on one, not the other, but on both. Application examples here we have 10 application examples. Reducing patient wait time, wait times. Another example, for instance, enhancing, we have improving claims processing accuracy. As for example, here, reducing patient wait times. Scenario: patients frequently complain about long wait times during peak hours. Proactive practice: analyze appointment scheduling patterns using practice management software and reassign staff accordingly. Resources: real-time analytics, staff training and time management. Outcome: reduced average wait times and improved patient satisfaction, i.e., moving 30% of routine appointments to off-peak hours reduces peak wait times by 15 minutes. Another example, improving claims processing accuracy. Scenario: billing claims are often denied due to missing information. Proactive practice: implement error checking software to flag incomplete claims. Resources: billing software, staff education on claims documentation. Outcome: lower claim denial rates and faster reimbursement, i.e., after adopting error checking software, claims accuracy improves by 20%. Enhancing patient feedback collection. Scenario: feedback surveys have low response rates. Proactive practice: introduce incentives and digital survey options accessible through patient portals. Resources: survey software, patient engagement strategies. Outcome: increase response rates, providing actionable patient insights, i.e., adding 1-minute feedback button to emailed receipts doubles participation rates. Another example, automating appointment reminders. Scenario: high no-show rates disrupt scheduling efficiency. Proactive practice: send automated reminders via email and text, including rescheduling options. Resources: patient management software like ZocDoc or Cario, just for example. Just as an example. Outcome: fewer no-shows, less staff downtime, i.e., appointment reminders reduce no-shows from 10% to 4% in 3 months. Another example, standardizing document management. Scenario: frequent document retrieval issues delay patient care. Proactive practice: digitize records and enforce naming standards for files. Resources: electronic health records, EHR systems, record maintenance training. Outcome: faster document retrieval, fewer patient service delays, i.e., transitioning to EHR systems cuts document retrieval time by half. Another example, training staff in effective communication. Scenario: patients complain about unclear or abrupt staff communication. Proactive practice: train staff in customer service and patient communication protocols. Resources: workshops, e-learning tools like LinkedIn Learning. Outcome: improved patient experience and satisfaction scores, i.e., soft skills training increases patient survey scores by 25%. Another example, monitoring staff productivity. Scenario: some tasks take longer than necessary, delaying operations. Proactive practice: deploy task monitoring software to identify bottlenecks. Resources: performance tracking tools like Clockify. Outcome: enhanced task completion rates and employee accountability, i.e., streamlining workflows reduces average task duration by 15%. Maintaining HIPAA compliance. And HIPAA, which is the the Protection or the Security of the Personal Health Data or Information Act, that is in USA. Of course, worldwide, for each country or geographical area, there is an act or regulation similar to HIPAA. Like, for instance, in European Union GDPR, which is the General Data Regulation, General Data Protection Regulation. Scenario: staff occasionally forget to secure patient files after use. Proactive practice: introduce regular HIPAA workshops and EHR, electronic health record login reminders. Resources: compliance training materials, system pop-up reminders. Outcome: improved compliance and fewer privacy incidents. HIPAA, i.e., HIPAA audits show 0 incidents after implementing monthly workshops. Example here: benchmarking workflow efficiency. Scenario: there is no data to compare scheduling workflows. Proactive practice: monitor task completion times and compare against benchmarks. Resources: workflow analytics, software, and training. Outcome: identify delays, implement optimization, i.e., staff complete scheduling 30% faster after adopting hands-on training. Here we have example on increasing accessibility for patients. Scenario: patients struggle to complete online forms. Proactive practice: simplify form design and offer assistance kiosks. Resources: usability testing, patient-friendly digital tools. Outcome: forms completion rates improve, reducing delays in service, i.e., replacing complex online forms with guided options leads to a 40% completion rate increase. Next, we have summary tables. As here we have table on key metrics and their applications, table on steps in benchmarking, table on SMART goals, as SMART stands for, again, specific, measurable, achievable, relevant, and time-bound goals in practice, table on continuous improvement strategies, table on application scenarios and proposals, and then next we have the MCQs or multiple choice questions in order to revise what we have covered through this lecture. Question 1. Which of the following is a key metric used to evaluate administrative excellence in healthcare? And the most appropriate answer is B, patient satisfaction scores. As patient satisfaction scores are a critical metric that assess the quality of the healthcare experience from the patient's perspective. Question 2. What is the first step in benchmarking process? Would be D, the most appropriate answer, is to identify KPIs or KPIs, which is the key performance indicators. As the first step is to identify relevant KPIs or KPIs that align with the goals of administrative excellence to focus subsequent efforts effectively. Question 3. Which of the following best describes a SMART goal in healthcare administration? As for here, we have C, the most suitable answer: reduce average patient wait time by 10 minutes within 6 months. As this goal follows the SMART framework, which is specific, reduce patient wait time, measurable by 10 minutes, achievable, reasonable adjustment, relevant, addresses patient concern, and time-bound 6 months. Question 4. What is a key advantage of using key metrics in administrative processes? And the most appropriate answer is C, providing measurable benchmarks for performance improvement, as key metrics provide measurable data points that help administrators assess and improve performance in areas like efficiency, accuracy, and patient satisfaction. Question 5. Which of the following represents a continuous improvement strategy in healthcare administration? And here the most appropriate answer would be C, integrating patient feedback into workflow optimization, as integrating patient feedback allows organizations to refine workflows continuously based on real-world needs and observations. And here we come to end of this lecture. Thank you very much and goodbye.